Welcome to Perimenopause Hell. The topic of this video is not a very easy one. This video is about libido. That's a fancy word for sex drive. So often during perimenopause, women may notice that their sex drive is not what it used to be. So either that can mean that you have a reduced sex drive, you don't really want sex, or even you find the idea disgusting, or that sometimes you have an intense desire for sex and you want a lot of sex, and your partner may find that quite odd as well. So although it sounds like something that a man might like, it might actually feel quite odd or strange. So it's an uncomfortable time for many relationships. What this is caused by, and the intention of this video, by the way, is that it is also for men in the Perimenopause Health for Men group. So I will try and explain things for both of you. So if we look at this chart, you can see that men's hormones reach a peak in their 20s and then taper off very slowly after that. So they still have a fairly high level of testosterone, even at the age of 80, if they're lucky enough to make it that far. Whereas a woman's peak in hormones comes in her late 30s, and then it declines quite steeply in her 40s. And this is what gives women so many problems. And generally, it's low estrogen that causes most of these problems. So if we look at this diagram, the female sex hormones that are produced by the ovaries here are estrogen, progesterone, and testosterone. Yes, you heard that correctly. A woman's ovaries do produce a small amount of testosterone, and this is thought to be responsible for female sex drive, although there is not as much research on this as you might think, and so we don't entirely know. And I will say that because there is a problem in terms of female libido, that we don't really have drugs and medicines to help reliably with female sex drive. And a woman's sex drive also has an emotional component that is not so easy to medicate or easily help. So anyhow, in menopause, a woman's ovaries stop producing estrogen and progesterone, but actually they continue for the rest of her life to make a small amount of testosterone, which is probably a bit of a surprise to many people. The adrenal glands also make a little bit of testosterone. It's normal for a woman to have a small amount of testosterone in her blood system. So although it's a male hormone, we also have it. So if we look at this diagram, which is the menstrual cycle of a younger woman, where the hormones all are looking as exactly as they should, the yellow line is testosterone, and you'll notice that it increases around ovulation. So this is Mother Nature's way of getting you interested at a time when you're more likely to conceive and get pregnant. So if your sex drive is not very good, what you might like to investigate is using some testosterone gel. Although women's ovaries continue to make testosterone, some women's ovaries make more than others. So it may be that you are a little low in testosterone. One of the things that is really useful to women is for their partners to go to doctor's appointments with them, because talking to a GP about your sex drive isn't the easiest thing in the world. And asking for something like testosterone gel may also be quite a difficult conversation to have. So it's very important if you have some moral support with you when you go to the doctor's appointment. Now, some doctors will want to do a blood test before they prescribe it to check that your own levels of testosterone are low, because if you take too much testosterone, it's masculinizing, which means to say you might start growing facial hair and various other unwanted side effects. You see, the aim here is to supplement your own hormones, not to start transitioning, okay? So there are some other products on the market, but I would really suggest that you stick with the gels that are a low dose. Too much testosterone for women produces many unwanted side effects like irritability and aggression, as well as physical changes that most women don't want. There are some products, particularly in America, like Estratest and BioTE pellets, which are inserted under the skin, and they last up to about 6 months, I think. But these are not FDA approved, and there's a lot of evidence of them being actually quite dangerous to the health. So I would suggest that you stick with things like the gels, which are low dose and are not going to cause any problems. The disappointing thing really is that testosterone only helps about 50% of the women that try it. So it has to be said that we don't entirely understand the cause of low sex drive in women. And there are other problems that need to be considered, like emotional problems, relationship, and the other effects of menopause. So, when we talk about menopause and perimenopause and the symptoms, it's very hard to be in the mood for sex if you are bone tired. Many women get insomnia, or they can't sleep, and they generally feel really crappy. So, sorting out those problems is really important if you're going to crack the sex drive issue. If you are tired and you didn't sleep very well for not just one night but several, then you are not going to want sex. That's the beginning and end of it. There's also another obvious problem, which is vaginal atrophy. And this can also affect the sensitivity of the clitoris. It can reduce the quality of the orgasms. So, getting any vaginal atrophy treated is also really important. And that's another situation where you need to accompany your partner to the doctor and ask nicely that this be treated. It is easy to treat. If it's not treated within the first 2 years of developing it, then some of those changes can become permanent. So, what we are talking about, when estrogen levels begin to get lower, women's tissues down there can become dry, the vagina can become uncomfortable and itchy, and the flesh in there can become very fragile, which means that during sex it can really hurt. And this might be despite using lubrication. You should never be offended if your partner wants to use lubrication. It doesn't mean that you don't turn her on. It means that her body is older and that it's not producing the lubrication. So she might feel very excited, but she is still not wet. So basically, don't be offended by that. It's just a practical problem. So learning to use lubricants is a part of having a happy sex drive or happy sex life when you're older. So don't feel embarrassed at all by that. And your partner should be treating their atrophy at least twice a week with either a over-the-counter cream like Replens or an estrogen cream from a medical doctor. And if that is done, you should be, having a happy sex life again soon. You can't have a good sex life if there's pain involved. So that absolutely does need to be treated. It may be the case that all the woman thinks about when she thinks of sex is, ouch, that's going to hurt, in which case, that's a very off-putting factor. Of course, it may be the case that you can change up what kind of sex you have. It may be that you need to have more oral sex rather than penetrative sex. There's all sorts of different things that you can do. You just need to both recognize that aging is involved in this for both of you, and there are going to be changes. I am not any sort of counselor But one of the things that I will say is that sometimes women think their libido has gone, when really it's nothing to do with that. It's the relationship where there's a problem. And often with long standing relationships, some sort of resentment or emotional problem has crept in. So if you're angry with somebody about something, then you're not going to want to have sex with them. So in this kind of situation, a woman might say, I'm really attracted to the pool boy. So I call this pool boy syndrome, or I find such and such a man really hot, but I just don't fancy my husband anymore. Mm. That is not a libido problem. The woman plainly still has a sex drive. It's that she doesn't have an attraction to her husband anymore for whatever reason. I can't advise anybody about that. It may be that you need couples counselling, or it may be you just need to break through your anger and resentment somehow. Because quite often you get into a vicious circle where, because you are cross, you don't have sex. And then actually your relationship gets worse because your man's behavior gets worse. And so it just ends up in a vicious circle. Sometimes, if you manage to get past that and you do kind of make yourself have sex, then everybody's in a happier mood and you actually end up enjoying it and the relationship gets better too. The other thing about sex drive in perimenopause is sometimes you'll find that you may not be interested in the idea, but when you get down to it, it's quite good fun. And the more you do it, the more you want it. So this is a really embarrassing topic to talk about, but I will continue. One of the things that I will say to the men who are listening and other partners, I don't wish to exclude gay relationships from this, but make sure that physical intimacy is not just about sex. That's really important. You can have an evening where you just massage each other, and you must not expect that to end in sex. This is physical intimacy, hugging, giving her feet a rub, or whatever that does not end in sex. If she feels that you are nagging her for sex, or you won't stop talking about it, she's going to feel pressured and it stops being a fun thing. It's on her to do list as a chore. So please make sure that there is time for physical intimacy that is not going to end in sex. If you feel that you can't have intimacy in the form of a massage or something without getting excited, then you must see to yourself first so that you don't feel that way and you are not overcome with your desire for sex. This is a way to make sure that you can keep your relationship going. And one of the things that you must recognize as you age is that for both of you, chronic illness and tiredness and aging are going to interfere with this. Your relationship will become more about companionship. Yes, we do all hear about relationships where there's still a lot of sexual passion into old age, but it's unusual. So we want everybody's quality of life to be the best that it can be. But for many of us, we're going to accept that our relationships do become more about companionship and other types of intimacy than penetrative sex. I think I've got to the end of my presentation now. Oh, no, there's one thing that I did want to mention. Another thing that you can do to improve sex without any medicines or creams or anything is exercise. This is not something that everybody wants to do. We are working with a yoga expert called Annette Garcia at the moment. There are Kegel exercises and other things that you can do to make sure that you maintain blood flow to the area and the exercise the muscles in the vagina to increase blood flow to the area. And that can also improve the quality of your orgasm. And it's the case kind of use it or lose it. So this improves the situation greatly, and it can also improve your urinary continence and other things like that. So it's not necessarily like an intense cardio workout or going to the gym. It's something that you can do at home, and it doesn't need to take you a huge amount of time. We have videos coming up that are about that subject, so stay tuned. The other thing that I wanted to cover before I end this presentation is herbal medicines for sex drive. Of course, there are lots and lots and lots of things. What I would advise you to do is pause this video and look at the different options in this article by Susan Weed, who is a very famous American herbalist. She has really good advice, and she actually has a book on menopause if you want to buy it. It's what you would expect from a herbalist. It doesn't have a very good opinion of any of the medicines and HRT or that kind of thing. So you're getting what you expect from a herbalist. But she recommends things like oat straw. Oat straw is quite estrogenic, so I wouldn't recommend it until you've actually gone through the menopause or you're skipping periods, because it will make your periods heavier if you're still having them. Schizandra berry. Many of these actually increase the blood flow to the genitals. They don't necessarily increase desire in the brain, if you like. They don't increase like a desire for sex. So the ones that I would recommend from this are Damiana. Damiana can even be smoked, actually. It sort of looks like mixed herbs. And it has that kind of flavour, actually, like a mixed herb type flavour, like a savoury type flavour. You could make tea with it, or you could smoke it. Similar to marijuana, you would smoke it. You don't necessarily have to mix it with tobacco. And it has a very nice sedative and relaxing effect. It isn't it's not as strong as marijuana. It won't make you high exactly, but it's quite relaxing. Marijuana, of course, as it says above, that's another option for those of you, if you can get hold of it and it's legal. Of course, some of you will still get hold of it if it's not legal, but it's good fun. We all did that when we were students, didn't we? I'm missing something here. I don't know which of these pages mentions Tribulus terrestris. That's another one that is supposed to increase desire, so that's worth trying. And I have finally come to the end. So if you liked this video or you find it interesting or helpful, then please like and subscribe and all that YouTube stuff.